Geneva campus. I'm Beth Carlson, the physician assistant, and I just want to go over a few items that have changed since we were all on campus in March. The first is mask. Everyone must wear a mask when in a building. You want to put your mask on, you want to fit it. Most have a wire over your nose. It'll stay over it, covering your nose to your chin. If you take your mask off, grab the loops from behind your ears. Do not touch the front of the mask and pull it off. The front of the mask is actually contaminated. It has the droplets on it. You don't want to touch this mask. If you are using a disposable mask, and this is the only one you have, and it did not get wet, you can place it in a brown paper bag, close the bag for 72 hours, and then you can rewear it. Otherwise, if you have the typical cloth homemade mask, same thing. Adjust it, adjust your nose, and when you take it off this way. These need to be laundered every time after you've worn them for an entire day. Masks are required anytime you are indoors and anytime you are outside within 6 foot of another person, you must have your mask on. Your mask serves two purposes. Number one, my mask protects you and your mask protects me. Number two, my mask keeps me from touching my face. You don't want to touch your face. You may have contamination on your fingers, and then the COVID virus can get into your system via your mouth, your nose, or your eyes. So please don't touch your face at all. Next up is hand washing. We know for a fact that the COVID virus can stay on inanimate objects for different periods of time depending on what the object is. So it's important anything that you have touched, you need to wash your hands, and you need to wash your hands frequently. If you do not have soap and water available, use hand sanitizer. That'll work. The hand sanitizer, as long as it's 60% alcohol based, which most of them are, is perfect in a condition when you do not have soap and water available. You want to start with having your paper towel dispensed so that you aren't touching the paper towel dispenser with your clean hands. And then you want to put your hands under the running water, get them wet, add some soap, and then you want to scrub vigorously for 20 seconds. We know that both soap and the vigorous scrubbing of the hands is what will inactivate the virus. So you want to scrub it, and you can either count to 20 or you can sing the verse of Happy Birthday, and that'll do the trick. And once you're done, you want to rinse your hands off. Then you come over and take your paper towel, dry your hands, and then turn off the spigots with the paper towel so that you're not touching the dirty spigot again with your hands. Social distancing is extremely important with the COVID virus. It has been proven that if someone coughs or sneezes and actually has COVID virus, the droplets will actually travel 6 foot distance. So that's why we maintain a 6 foot distance between you and the person next to you with a mask on. If you are exercising, we know that forceful expiration, actually the droplets can go up to 12 feet. So we always want to protect yourself, not get within 6 foot of someone else, and maintain that social distancing to keep you from getting exposed to the virus. There are certain populations that are at higher risk for getting COVID than other populations, and those populations include anyone over the age of 65, anyone who is morbidly obese with a BMI greater than 35, anybody with high blood pressure or what we call hypertension, anybody with asthma, anybody with diabetes, and anyone with heart disease. The other population is those that are immunocompromised, and that may be somebody with an immunodeficiency disease or someone undergoing chemotherapy. The people in these high-risk categories need to be much more cautious as they advance into the yellow stage here in Beaver County. It is recommended that they actually sort of stay and keep the same precautions that they have in the red phase, which would include only going out for essential items, try to send someone else to the store, and try to avoid crowds. Even though we're allowed to have groups of 24 people with masks and social distancing, you still want to protect yourself and only stay with those people within your household if you are in that high-risk population. The symptoms for COVID have actually changed since I may have last seen you on campus in March. There are now 7 symptoms that are primarily associated with those folks who have COVID. Those symptoms include fever above 100, cough, shortness of breath, new loss of sense of taste or smell, sore throat, chills. And when I say chills, it's like shaking chills, and muscle ache. A couple other symptoms that people with mild COVID experience are some gastrointestinal symptoms, which may include nausea, vomiting, diarrhea, and some folks actually get what we call a conjunctivitis, which you may know as pink eye. They'll actually get some red eye irritation. Those are also some of the symptoms. The problem with COVID is we know that the younger populations aren't always displaying symptoms, so we don't know that they're sick. That's why wearing a mask and social distancing is so important, because there is what is called asymptomatic spread of COVID. Those folks actually have it, walking around in public, don't feel sick, have no symptoms, but are spreading it. According to the Department of Health guidelines, in order for us to have employees, visitors, or students back on campus, everyone who walks on campus will be asked to do a daily questionnaire. This will either be reported to your supervisor or the Human Resources Department. This questionnaire will ask you about the symptoms I just discussed. It will also ask if you know if you've had any known contacts of anybody who's had COVID. Going forward, this is how we're going to try to keep the transmission of COVID in the community to a minimum. So if you wake up in the morning and you have new onset of any of those symptoms, please call your supervisor and do not come on campus. We need to do our best to try and protect everyone here on campus and keep everyone healthy. Geneva community, we can all do our part to keep the transmission of COVID to a minimum on campus. By doing that, I'm asking each of you to wear your mask, practice social distancing of 6 foot, use your hand sanitizing or hand washing skills, and to try and be aware of any symptoms you may have. I appreciate everything and anything each of you do to help to keep all of us healthy. Thank you.